Whether you're experiencing a dull, constant pain or a sharp shooting pain down your leg, actually 80% of Americans will experience some form of back pain within their lives. Coming up, some great treatments and remedies to keep you pain-free. It's time to get fit. It's time to eat right. It's time to change your life with Peter's Principles. Welcome to Peter's Principles, a show dedicated to changing your life through proper nutrition and exercise, and just making better choices to put more quality in your life. I'm dedicating today's show to back pain. Whether it's a pinched nerve, a herniated disc, or a sharp pain going down your leg, if you have back pain, you know it can be debilitating. Back pain actually makes more people miss work only second to the common cold. And regardless of the cause, whether it's picking up a simple piece of paper or it's a severe accident, if you have back pain, it turns your world upside down.
Well, I had a small incident at work, and I didn't think much about it at the time. I was moving a tray of instrumentation, and I felt a little pop. Maybe about 6 months later, I started getting these sharp pains down the back of my leg, and it would go numb. I was having a hard time walking upstairs. I was actually having a hard time walking. I'd roll out of bed in my worst pain. They had me on 6 different medications all at one time. It was miserable.
That was until Scott Shaw visited Dr. Robert Johnson, the chief of neurosurgery at Sinai Grace Hospital.
How about over here?
No.
Over here it's okay? Can you bend forward? How far down can you go before it starts to bother you?
Right about there.
Okay. Most people that have back pain, it usually goes away within about 4 weeks in about 90% of the patients. He continued to have pain, and it was actually getting worse. The treatment choices...
After trying physical therapy, Scott decided his best bet was surgery. Dr. Johnson would enlarge the holes surrounding the nerves by scraping away some bone and any scar tissue.
What I can do now is unbelievable. I mean, I'm walking, I'm going up and down stairs with no problems.
The back is mainly composed of the bones that support your spine. It's what everything else, to bluntly say, is hanging off of. Your rib cage is connected to your spine. It supports your head. It is what lets you stand up straight. It all is interconnected, and if one part starts to break down, it can affect other areas. So that's what makes it so difficult to figure out why people have back pain, because it could be the muscles, it could be the support structures, it could be just inflammation around a nerve, or it could be inflammation in the nerve. And so we have to sort out all those things.
It was like life started over again almost, I don't know.
Coming up, some alternative back therapies that may give you relief.